How to use digital blood pressure monitor. Steps for accurate BP measurement. Proper positioning, measuring, saving result, do's and don'ts. Sit comfortably with back supported. Don't cross legs. Feet flat on the floor. Place your left arm on a table or desk. Elevate your arm to level of your heart. Cuff should be placed on upper arm. It should be tight enough to only slip 2 fingers. Tube should fall on front of central arm, tubing to be at downward side. Press on/off button to BP monitor. Cuff will automatically inflate and deflate by itself. When the heart icon stops blinking, the measurement is complete. The display will show your BP readings. 119 is systolic value, 81 is diastolic value, 70 is pulse rate. The results can be easily saved in our POCT app. Set date. Set time. Add systolic value in sys. Add diastolic value in dia. Save the readings. It will help to keep track of your readings regularly. 4. Do's and don'ts. Do's. Read instructions carefully. Sit comfortably with back supported. Upper should be bare or wear a thin cloth. Put the cuff and relax for 5 minutes. Take 2 readings. Record date and time. Don'ts. Don't smoke, bath, eat or drink alcohol or caffeine 30 minutes prior to take measurement. Don't cross legs. Don't measure BP if you're cold, nervous, uncomfortable, in pain. Don't eat big meals within 2 hours. Don't talk or fold arms. Live healthy, live long. Thank you for watching this video.